Deputy Wallace.
Taoiseach, we have a mental health and a suicidal crisis in Wexford. Not everyone presents with suicidal ideation, and it's not always possible to identify signs that someone might be suicidal. But there seems to be an incredible lack of an emergency response to those who do actually present with suicidal ideation. Kenneth Rowe, just over a year ago, took his own life at the age of 32. I read a letter from Kenneth's sister in this chamber before Christmas, and I'll repeat a line from it. Imagine our despair, she said, that in spite of an urgent referral from Waterford to Summerhill Community Mental Health Services, Wexford, Kenneth's appointment was for 6 weeks later. The wait was impossible. Kenneth fought hard to stay alive, but he didn't make it. He ended his life 19 days before his appointment at Summerhill. I've spoken to the parents of a number of children in the last year or so who have all presented with suicidal ideation and have had to wait for over 2.5 years to get the supports they needed from CAMHS. Dr. Kieran Moore resigned from his position as consultant child psychiatrist almost a year ago, and we still have no replacement. Anne O'Connor, the National Director of Mental Health Services in the HSE, said in 2017 that CAMHS had become a catch-all service in the absence of other services. It was never designed to be a catch-all service, but to cater for children and adolescents with severe and enduring mental illnesses. Children are funnelled into CAMHS who don't need to be because alternatives are not there. And O'Connor said young people should be able to go to their GP and get access to a primary care-based psychology or family counselling service. But Taoiseach, the waiting list for primary care child psychology services in Wexford are over 3 years long, despite the fact that 4 newly created assistant psychologist positions in Wexford were filled in the last year. 3 years, Taoiseach, is hardly good enough. The Future of Mental Health Care Committee's final report expressed serious concerns at the lack of accessible counselling services, and it says the money spent by the state on the services is insufficient, particularly compared to expenditure on psychotropic medication. The report also states that evidence supports the fact that there is an over-reliance on medication as a response to preventing mental ill health issues in the absence of alternatives in primary community care levels. The Ombudsman for Children told the Oireachtas Committee that children themselves have identified a rush to medicate in their treatment, which is an incredible statement. The lack of adequate community and primary care mental health services in Wexford is a serious problem. The pace of change is painfully slow, too slow for some. Kenneth Rowe was one of those. Taoiseach, I realise that suicide figures are down nationally, but they're still incredibly high in Wexford, one of the most concerning issues in the county at the moment. Do we need more resources? Do we need a different approach? I know it's not easy, Taoiseach, but whatever we're doing, it doesn't seem to be good enough.
Thanks very much, Deputy, and I'm very sorry to hear about the gentleman who you spoke about and his experience, and I know you've raised it before in this House, and all of us in this House, or I doubt anyone in this House, hasn't in some way been affected by suicide or doesn't know somebody who has taken their own life. And we all know the enormous grief that causes and the effect it has on families and friends, a grief that never dies and goes on forever. Have you said yourself this is an area in which we have seen some progress in recent years? The number of people taking their lives in Ireland has gone down by about 30% since 2012, and suicide rates in Ireland are now roughly at the EU norm. But statistics like that mean nothing, of course, to anyone who's had it touch their lives. And of course, I acknowledge that it does vary from place to place in the country, although I don't in front of me have that particular breakdown. In terms of what government can do, government is really committed to developing mental health services in the broadest sense, both through the health service but also well-being and education, for example, which I think is really important too in resilience. The budget for mental health will approach €1 billion this year. A very large budget, acknowledged by experts like Joan Freeman, for example, as being more than is spent in many other similar countries, and provides an additional €55 million for the development of services in 2019. So we need to make sure that that money gets to the patients and that that money gets to those who need it most. At the moment, there are 2,560 children on the CAMHS waiting list, and the HSE is prioritising those waiting more than 12 months. That's about 295 at the moment. So all aspects of CAMHS will be improved as part of the service plan in 2019. That involves better out-of-hours cover and 7/7 cover where possible, progression of day hospital care, developing specialist teams for eating disorders, for example, and improved prevention and early interventions. There are now 70 CAMHS teams and 3 paediatric liaison teams. And Mr Daly, who's the lead minister for this matter and on the issues of mental health, is going to meet the HSE on the 23rd of January to review progress on all aspects of CAMHS, including waiting lists. And I'll ask him to raise Wexford as a particular black spot when it comes to these matters. We now have 114 assistant psychologists hired and 20 psychologists recruited for the primary care service. They were recruited throughout the course of last year, and we hope that the full year effect of them being employed now will make a difference in terms of waiting times.
Deputy Wallace.
Thanks, Minister. Around 2,500 people were referred to counselling in primary care in 2016 and 2017 in CHO 5. Around 950 people were referred to the self-harm intervention counselling programme in the same years. I asked the HSE for the number of people being prescribed antidepressants for the same years, and the numbers I was given was 249,500 for 2015. But the number I was given for 2016 was 390,000. And this is just for data for people using medical cards. That's a 36% increase. 36%. Listen, we know that medication can be helpful, but the number of people on antidepressants compared to those receiving counselling is totally out of sync. Any psychiatrist who believes in the idea of recovery will tell you that antidepressants are not intended to be used as a long-term solution, and that taken in the absence of ongoing counselling or talking therapies are damaging in the long term. Yet in Ireland we have over 250,000 people of medical card holders on antidepressants, and maybe only 1 in 10 of those talking to anyone about the root of their problems. It's a recipe for drug dependence, and doesn't lead to a lot of recovery, Taoiseach. Taoiseach, people in Wexford are desperately wanting things to be different. Kenneth Rowe's family have spoken about the lack of talk therapy being offered to Kenneth. He was put on powerful antidepressants though. On the 2nd of January 2018, his prescription was doubled. His agitation became extremely intense and he was dead 3 days later. We'll never know if talk therapy would have saved him, but we owe it to him and others to make real change to the way we provide mental health care in this country.
All right, thank you, Deputy.
Because, Taoiseach, it isn't good enough.
Taoiseach, to conclude, please.
Thank you, Deputy. I think it's important to say that medicines, antidepressants, anxiolytics, antipsychotics, medicines that are used to treat mental illness have a role to play in treating mental illness. And I know you're not disputing that and you don't disagree with that. And when they are prescribed, they're prescribed by GPs or prescribed by psychiatrists. And I'm sure that in the vast majority of cases, when they prescribe them, it is appropriate that they do so. But I also acknowledge the point you're making, which is that it is much easier for a doctor to prescribe medicine and the patient can get it within hours than it is to get for them counselling, cognitive behavioural therapy, the talk therapies. You can sign the prescription, you can give it to the patient, that patient can be in the pharmacy within an hour, they have their medicines. It takes much longer for patients to get access to other treatments, behavioural therapies, counselling, all of those things that we also know have an effect. And I think that is a very fair point that you make. Mr Daly is here and he says to me that he is going to meet the CAMHS team's management and clinical leads next Wednesday, as well as senior HSE management. And as you know, there is 55 million available to make meaningful improvements in mental health in this year ahead. And the challenge always, and it is a challenge for government, is to make sure that money gets to the patients. And if it works, what we should see is more people getting access to those therapies more quickly, and perhaps as a result of that, a fall in the number of prescriptions and a fall in medication costs.
Thank you very much, Taoiseach.